Thank you everyone for joining us for this virtual program, Health Insurance Get Covered NJ and NJ Family Care for 2024 enrollment. I leave you now with our presenter, Yamilet Zegarra from Family Resource Network. Sorry.
Hello, good afternoon. This is Yamilet. Yes, I'm the resource coordinator and a bilingual navigator. I just want to let you know that this time we're going to talk about health insurance for GetCoveredNJ and NJ Family Care, which is the open enrollment November 1st this year, 2024, and starting the 2025. So we're going to talk about that one. Basically, what GetCoveredNJ is basically a system, a platform that the NJ state has in order for us to apply for health insurance. Anyone who lives in New Jersey is a requirement that they need to fill out this application and be able to submit it during the open enrollment process. This is for you to get different type of health insurance, benefits, everything depends on the income that you guys have. What is the circumstances or situations that you have also in your life, and we can browse plans and we can talk about what the specific plans is covering. Most of them, they are covering preventive services, which is good. So everybody who has any chronic condition might not be actually will be accepted by the insurance and is not going to be rejected by the insurance. So at this point, everybody is welcome to apply. From November the 1st is going to be the first day for that, and most likely will last until January. And we have to also mention that the coverage for this open enrollment is basically for 2025, which is starting January 1st, if you enroll before December 31st, right? So everybody's welcome to do that. For NJ Family Care, it's quite different. It's more like in terms of Medicaid or Medicare. They have their own navigators there. You will have to get through also the process and getting in contact with them and following anything that they need to do. But we can always apply and GetCoveredNJ and have options, like only one application can be submitted. And this application, if you are able to, or you are qualified to get Medicaid, the whole system for GetCoveredNJ will tell us that you qualify for that, and you will be able to continue and following anything that they're asking for, income information, expenses, anything that you want to provide, like in terms of health, in terms of most likely like expenses and income is the one that is important, because you have to let them know what are your expenses and that you are most likely eligible for any affordable health insurance. And that's the key to say it. That's why I always ask for it for the expenses, so they can learn more about like what exactly you are earning and what exactly you're spending on, so you can get a better coverage, right? Better insurance at that point. So everybody who is making changes in the 2024 coverage in November has to make sure that by the 25, they are auto-renewing the health insurance. That means that if you apply right now on the open enrollment, we can always follow up with you for January or February, let's say. We can get into your application and make sure that everything is renewing and everything is set up, so you won't have any issues with the insurance at that point. Who is eligible? Well, everybody is eligible to apply for Marketplace, and the minimum requirement is to have a employment ID or the employment authorization card, because we will need the code that is there in the ID. We need to put that into the system. We need to make sure that we select that option. That's actually the let's say that's the minimum requirement, and the rest is just like if you're resident, you're a citizen, we always be able to get that information, like your social security, like I said, your taxes, if you did, or at least if you have an estimate of how much is going to be your taxes for that specific year. So we need it, and we cannot be incarcerated. That means that no one that has been in jail will be able to access to this benefit. And like I said, minimum requirement, ID, and a social security number. When we are enrolling people, we always ask to make a consent form, which is basically a consent that you are giving me to apply on your behalf and to have access to this sensitive information like your ID numbers and your social security, and most likely income taxes if it's the case, and if they are asking for it, right? So we have to do that in advance in order to register. We also have in the system a plan that can compare. It's gonna give you, if you qualify, let's say, for a minimum payment of $10 monthly, which is calling the monthly premium, that's basically your monthly payment of $10, they're gonna give you probably about 10 or 15 different options where you can choose which one is the best for you, depending on your medical circumstances, depending on your health, depending on what type of insurance are you looking for. Some people just look for insurance to get the annual wellness visit or physical, and some other people are just having more like chronic conditions, diabetes, asthma, and so on, so that they require a plan that will coverage all these medications. And at that point, the plan may change a little bit in terms of dollars, like premium. Maybe it's not $10, maybe it will be $15. But that also depends on how we apply and what doctors do you want me to add in your application, what medication are you taking, so we make sure that we can get the most accurate health insurance for you. So by the next year you will be covered. But that's basically how it works, right? When we talk about the yearly total cost of the financial assistance eligibility, basically what it's saying is that every single insurance is very high in cost. It costs probably $800. But again, if you are looking to get something affordable, we also have to look into your income. How much was your income in 2023? How much was your income, or how much you think it will be in 2024? So based on that, we put your social security in the system, and the system will let us know. Because since everything now is connected online, they can get in contact right away with the IRS and find out how much is the total and with your social. And at that point, they will tell you how much they can help you with. And the financial system is meaning that the insurance is costing like $800. You are on the lower poverty level of the insurance at that point. I mean, of the level that they have to clarify like which one is the amount of money, what's the level that you are located in. If you are above, let's say, as an example, it's not like real data, but as an example, if you are above 20, for example, 20,000 per year, they will probably say, hey, you know what, the insurance costs $800. And because you are above 20,000 per year, that means that you will have to pay $25 monthly, right? And that we are going to cover the rest of the insurance, saying that they're going to split it. And at that point, as I make it very simple example, is that $800 is the total amount of the health insurance. And then we're going to help you to cover $700. So basically, you're going to pay $100 that we are going to split during the 12 months. So that's basically how it works. But if you are doing over $80,000, so that's something different. And they will tell you, hey, we can help you, but you will have to cover $750. And then, we are going to cover it only for $50. So again, this is based on your income. Nothing is really like saying like, hey, you're going to pay this amount of money because this is what it is. No, it's everything depending on how your income is changing. And yes, they're going to determine which one is the price that you are going to end up paying, right? But most of the cases, it's pretty good. It's pretty beneficial. They also provide you with a type of debit card where they put some money in there so you can use it for your medical expenses like co-payments or medication. So it's pretty good. And most of the people, end up with these benefits are pretty good, and they can afford, at least, because previously it was really hard to afford health insurance, right? But right now it's easier in that sense. And required information that we need is, well, they are, checking if you are eligible. They say for NJ Family Care, which is Medicaid, you have to be at least 5 years living here as a resident with a green card to be able to get Medicaid. And they always gonna check what is going to happen with you, like in your monthly payment. Like, if remember, they have your social security, so they will going to monitor every month, like how things are going with you in terms of income, and they will let you know. If you qualify right away, they will tell you. But if they don't, most of the time what they do is they send you a letter saying that you are being denied for that one. And I always recommend that you have to keep this letter with you, because if you are not having access to Medicaid, then we have to go to GetCoveredNJ to get you an insurance. It is a law in New Jersey that every resident in New Jersey must have insurance. If you don't, at the end of the year, when you do the taxes, that's when they're gonna ask you, like, do you do the insurance? No. But if you don't, there's a penalty. And the penalty might be about 350, 450, depending on whatever they have at that moment. This year I think it's $350 out of your, taxes that you have to pay penalty if you don't get registered for the insurance. So just remember, you always have to register. And when we apply for GetCoveredNJ, and if you are being denied to have Medicaid, we're gonna apply, we're gonna put every information that you have. And also, if they ask in the system that we need to upload that letter, then you have to send it over, the letter, and we're gonna upload it in the system. I am gonna be able to help you with that if you want. And I can upload it for you. And probably within 24 hours, they will tell you, okay, you may not qualify for Medicaid, but at least you have some insurance that could be affordable for you. The minimum could be $1 monthly payment. The maximum could be $700 monthly payment. That it has happened also, so I can't really tell you like how much it will be, but the system will tell you how much it could be for you. Important, if you are already registered and if you're having questions about the application and you know that you were doing GetCoveredNJ last year, 2023, just remember to always get into the GetCoveredNJ. If you have your ID, user ID, your password, you can log in, get in, and try to update all your tax information, because it will be really hard if you first try to apply again when you have already an account. And if it's coming up as a duplicate, I mean, there will be some very potential tax implications, like they said here, right? So you have to make sure that if you are already registered in GetCoveredNJ, just provide your ID and your username and your password, and we can have access to that and make sure that we can update anything that we need to update for that specific year. But don't try to do another, because if you do a double application, there will be some issues there. And then we have to make it on time, on the open enrollment process time. And if we are doing it at the end, and then it takes time for the system to recognize or to void one of the application, I mean, you may end up not having insurance. So we don't want to do that. We don't want to create double application, okay? For those who apply for NJ Family Care, which is Medicaid, Medicare, I have to tell you that our department for navigation is mainly for GetCoveredNJ. Since we are qualified and certified to do that, we are able to log in and get access to that platform. But for NJ Family Care, Medicaid, Medicare, they have their own system. They have their own group of navigators that you may go there. I can assist you with that, providing the phone number or email address from them, but not necessarily getting into the application, since we are not navigators from NJ Family Care. We can help you with the first registration and the application, but not that we are having access to their system. That's something different. That's something that you will have to get in contact with them if it's Medicaid. Thank you so much for hearing. If you have any questions, please feel free to reach to me. I say gracias. This is thank you, basically. And I also bilingual. So if you're happy with or you wanted to know any information, or just email me, please, get in contact with me. My phone number here is 609-276-9595, and get in contact with me, text me, email me, and anything. I'm gonna be here. We are always making appointments, because if you are new for GetCoveredNJ, we have to have at least 20 to 30 minutes to be able to apply for the application. And as I said, we have to do a previous consent form in order to do that. And then we can do the follow-up. Thank you then.
Thank you, Yamilet. Okay.